How do you get back to some kind of normal life when the threat of coronavirus is still very much around? And how do we prevent having a total national lockdown again? The government now wants you to do this.
If you get symptoms, isolate immediately and get a test. If you are contacted by NHS Test and Trace, instructing you to isolate, you must. It is your civic duty. So you avoid unknowingly spreading the virus, and you help to break the chain of transmission. This will be voluntary at first because we trust everyone to do the right thing. But we can quickly make it mandatory if that's what it takes.
So what will be different tomorrow? If you have symptoms, you'll still go online and get a test. That bit stays the same. But it's if you test positive, then a contact tracer will be in touch with you and they'll ask who you've been in recent close contact with. Then those people will have to self-isolate for 14 days, even if they don't have symptoms. But this counts on people being compliant and also getting speedy tests back within 48 hours, which has proved tricky, especially for those postal ones.
If lots of people do use this system, what difference do scientists think it could make?
It's really important to help us know about where the epidemic is. It's part of the sort of surveillance program that says this is where a lot of transmission is going on. We need to move in here and really focus on trying to reduce transmission. Why are we getting outbreaks, for example, in this hostel, that nursing home, this hospital? What is it we can do to stop transmission going on?
This scheme only applies for England. Scotland's Test and Protect also goes live tomorrow. In Wales, this will start on the 1st of June, and in Northern Ireland, they've already rolled out a contact tracing plan. This is a scheme we've had in place before it was abandoned by the government on the 12th of March. Then they had 80 contact tracers. Now they have 25,000.
It is a huge imposition, but it will be on a very small minority of the population, a very, very small minority of the population. And I would just say to everybody that it's worth it, because that is the way that other countries, that is the tool that other countries have used to unlock the prison, to make sure that we can go forward.
10일 하루만 측한 거예요?
Countries like South Korea, their use of test, track and trace has been seen as one of the reasons they've had relatively few cases and just 269 deaths. Key to South Korea's success has been the use of an app. The one being developed by NHS is being trialled on the Isle of Wight, but is not part of this rollout. The scientists behind the launch say an app is the cherry on the cake, not the cake itself. They also haven't given a date on when one would be available. For now, this is all voluntary, but the Prime Minister suggested fines could be considered for those who don't comply.
Now, whether Dominic Cummings' trip was within lockdown rules or not is one for debate. What is more clear is that people are already asking if it's OK for them to do the same. Some fear that could undermine lockdown rules and spark an increase in COVID deaths, like Stephen Reischer, a behavioural scientist who is one of the experts who fed into the group designing the guidelines themselves. He joins me now from Fife. You have said that the Prime Minister's defence of Mr Cummings has trashed public trust. What do you think its effect on compliance will be?
Well, I think it's really important to distinguish between trust and compliance with the government and adherence to restrictions. So let me explain what I mean by that. I think there is very little doubt, and the polling shows it very clearly, that most people think now there is one rule for them and one rule for us. And all the research on compliance with authority shows it depends critically on thinking that authority is part of us, is with us, is for us. And so once you create that sense of us and them, you undermine trust and you undermine compliance. However, there is a positive side as well, because I think many people are going along with restrictions, not because they're being told to by the government, but because they realise it's the right thing. And if you look at the data on people's own behavioural intentions, it doesn't look as bad. And I think the point is this, that there is an irony here, because to the extent that people think that Dominic Cummings is one of them, and so they think that his behaviour doesn't represent them, it's counter-normative, it can prove a model of what we shouldn't do. So what Cummings did as I say, to the extent that it is viewed as an act which goes against our norms and our values, that he looked after himself, but we look after each other, then there is still hope that people will go along with these things, not because of the government, but despite the government and what Cummings did.
Yeah, I mean, hasn't the public actually shown that it's much more responsible than a lot of experts and politicians thought they would be? So perhaps there's not very much to worry about.
Well, one of the ironies, I think, of this whole affair, of the whole pandemic, has been there's been a sort of inversion. The public has led time and time again. The public has led around the question of lockdown. The public has led around the question of the economic support for people so they can abide with lockdown. Leaders and followers have rather been inverted in this, that we've seen the good common sense and the sense of collectivity of the British public and not of the government. See, a while back, Andrew Cuomo, a beautiful quote. He said, look, you've got to understand this is not about I, it's about we. To get through this pandemic, you've got to get your head around the we concept. Now, the problem was not only in what Cummings did, but in the way that he was defended by Boris Johnson, there was a sense that actually ultimately it's about I. If the going gets tough, I can decide what's good for my family. But the public have said, no, actually, when the going gets tough, we go along with these things because it's good for the community. The public understand the we concept. The government, Boris Johnson and Dominic Cummings, don't seem to have got their head around that concept. But still, for all that, we still need government and we need good leadership. And it's not a good position to be in when the public is not supported, is not scaffolded, is not given an example by a government. We need a government that leads and brings us together and gives us a sense of community.
Well, as somebody who's been part of the process of drawing up these guidelines, do you think your colleagues, the scientists, should be intervening more in what is essentially a political problem from what you've described? I mean, we haven't heard from Chris Whitty or Patrick Vallance since this story broke. Do you think they should be standing up and saying something about it?
Look, I can't speak for others.
Or should they just stick to science?
I speak here for myself. And the reason why I became involved in the process, the reason why I wanted to become involved in this process is because, I mean, it's a privilege, but also it's a pleasure that you can use the research and work you've been doing for many years to help public health. And the point that I want to make is that in order to protect public health, adherence is going to become even more important than it was under lockdown. Actually, to adhere to test, track and trace, to isolate yourself when you're not ill, when everybody else is going out, is a difficult thing to do. And we'll only do it if we're not thinking about ourselves as individuals, but rather we're thinking about the good of the community. And therefore, stressing the need to act collectively, stressing the need that when it's difficult, we don't think of exceptions for ourselves, we think of what is good for others, is going to be more important than ever. And I think all the research that we've done on compliance and on messaging shows how critical that is. And that's why I think it's still necessary for us behavioural scientists to be involved in that process, to keep banging that drum and hope that eventually our leaders might hear it.
Stephen Reicher, thank you very much indeed.